morning. Great to be with you again. So happy to have us along with you wherever you are, whatever you're doing on this busy Saturday morning. You know, your body is always busy. We live inside this little chemical factory that really depends on several different processes all happening just at the right moment and in the right way. And when it gets off the tracks, you can have a number of different consequences. And that's what we're going to talk about today with pharmacist Greg Russell, the founder of Fort Wayne Custom RX. Great to see you again.
Great to be here.
Well, one of the things that we're going to talk about today is this process called methylation. We hit on that last month. We're going to revisit it this month, tied to some very specific conditions. When methylation goes off the tracks, you are at increased risk for, a number of conditions. What are those?
Sure. Now, well, last week we specifically spoke about cardiovascular disease. We talked a little bit about one of the markers called homocysteine. And just kind of a real quick recap. Remember, the methylation cycle is a series of cycles that spin together, and basically they keep turning and they keep churning out end products, and those end products do different things for our health. And if for some reason that cycle quits spinning like it should, then we start seeing some potential damage. And we basically talked real briefly about B vitamins, and we won't spend much time on those today. We talked about the active folic acid and the active B12 and some of the other vitamins that are important for that cycle. Today we'll spend a little bit more time talking about some of the other diseases other than just the cardiovascular disease, which we spent a great deal of time last week.
Yeah, and those conditions are everything from, ADHD and autism to Alzheimer's disease, Parkinson's disease. The list just seems to go on and on.
Yes, it does. And so what's really interesting to me about the methylation cycle is you can almost kind of divide it down into two types of groups. I guess three, because we talked about heart disease last week. But the other things that the methylation cycle, they seem to be really involved in our neurochemistry, our brain chemistry. And so that's why when it's not working right, or when you have some of these genetic factors that make that cycle sluggish, that we need to look deeper. And again, the whole idea is to prevent, right? To prevent, we're trying to look 20 years ahead and try to prevent something that might happen. And we'll talk about some of that today.
Now, I'm going to take a stab here at recapping kind of what this methylation thing is all about, and correct me if I get this wrong.
Sure.
So we're adding a chemical compound, a methyl group, to our DNA, and that sort of turns up or down certain gene expressions. So we're cranking the volume up, we're cranking the volume down, we're turning it on, we're turning it off with these methyl groups.
Right. So again, as you said, you're either upping the enzymes or decreasing enzymes, and so these different chemical processes in our body, and we looked at the brain chemistry. Also, we look at what's going on in the liver. So I kind of think of it as what's going on in my brain, what's going on in my liver, what's going on in my heart. Those three things.
That makes it real simple. That's great. So let's talk about when we think about the brain and all those neurochemicals, what do we need to be paying attention to?
Yeah. So, again, doing some of that genetic testing, seeing if our homocysteine is increasing, and that's something you can measure like yearly. And if you notice your homocysteine is increasing, then that should be kind of sending off some yellow caution, red flashing lights that, hey, maybe there is an issue here. But basically, there is connections. For example, we look at Alzheimer's patients. So they looked at a case study looked at genes, for example, of two different engineers, two identical twin brothers that were engineers, worked in the exact same company, had the exact same exposures, except one worked in the chemical line and one worked more in the office. They basically lived very similar lifestyles. But what happened is the one that worked in the chemical, something triggered his genetic expression, and he developed Alzheimer's, whereas the other twin brother did not. So those are like little hints Not saying, hey, for sure, that you're going to develop Alzheimer's, but you have to start thinking about what are your risk factors and how do we mitigate some of those?
Yeah, and that is something that we can change. This methylation process is affected by not only the environmental chemicals you just mentioned, but stress and, of course, our diet, exercise, all those things. And as we age, the pattern of methylation changes as well.
That's correct. So, for example, when we talked about the Alzheimer's patients, patients, and we noticed this with Parkinson's patients too, different areas of the brain have methylation patterns, and they are looking for these specific patterns to see if they can be a clue that they can predict, okay, this person is a much higher risk for all, and they've been able to identify certain regions in the brain. So for the Alzheimer's patient, or I'm sorry, the Parkinson's patients, you have part of the hippocampus, which makes dopamine, and dopamine, of course, is important for proper levels of dopamine. If you can't make dopamine, then you develop Parkinson-like symptoms. So they're looking at those things. So certain nutrients we're also looking at. So when we look like at Alzheimer's patients, we realized they did not have a chemical called S-adenomethionine. Okay, or we call it SAMe. It's easier to say SAMe than that word.
Much easier.
But that methionine portion of it comes from methionine out of that cycle. So what researchers are doing now is they're giving some S-adenomethionine to try to replace that for patients that are at higher risk for Alzheimer's disease.
So the SAMe is available as a supplement. I can just take it, and does my body is able to use just as much as it needs?
Right. It kind of look at SAMe. There is some controversy that if you take too much of it, you might cause issues. However, clinically, we really don't see that. That's more in theory. But SAMe has some neat applications. So one thing I love about SAMe is it's also anti-inflammatory. So we use SAMe for patients that have inflammation and pain too.
So who should be taking SAMe? If I have Alzheimer's in my family, should I just think about taking this stuff?
Yeah, I think that's something you should consider if you have the genetic defect, or your homocysteine levels are going high. So, homocysteine is real simple to measure, and that would be one of my yes, if genes, funny thing about genes, right? I can love my mom, I can love my dad, but I can't pick what they're going to give me, right?
Right.
So, if you got a good gene pool, you don't have as much to worry about. But yeah, we use SAMe quite a bit. That's a wonderful thing. SAMe also has some relationship with has an antidepressant effect. So,
really?
Which is really interesting. And again, we have to be kind of careful with SAMe because certain types of antidepressants it seems to be work better with. Other ones we're a little more concerned about serotonin syndrome because it is a methyl donor. The question is, can it ramp up serotonin and cause serotonin syndrome? So that's a theory. It hasn't been proven one way or the other, but we use SAMe a lot, and it seems to have an antidepressant effect.
So boil that down for me into a nutshell. I should be thinking about SAMe if?
I would think about SAMe if I have, number one, I have methylation issues. Okay, by looking at testing. Number two, if I need an anti-inflammatory, SAMe might be a nice one to try. Because if kill two birds with one stone per se, or maybe have some depression, whether it's mild. And of course, depression's a clinical disease, and I'm not saying that you should not get help for your depression, but sometimes people feel just a little blue. Maybe something like that could help.
And with these types of supplements, how soon am I going to see some response? How will I know that it's working?
Yeah, it takes a few months typically for this to work. SAMe, there's a study where they use SAMe versus anti-inflammatory agents like ibuprofen or naproxen, and they found it takes about twice as long. Whereas patients that were taking ibuprofen could see things within a few days to a week. It takes about double that time with SAMe.
Well, as we've learned over time, taking a drug to solve a problem is quick and easy, but if you solve the underlying problem with some supplements or other issues, you get a longer term result.
We all know my opinion on NSAIDs. I think NSAIDs are okay in short-term use, but long-term they lead to other problems such as renal failure and certainly they're associated with some different heart diseases. So, and of course, our favorite disease, peptic ulcer disease. Yeah. Nobody wants that.
Nobody wants that. And I am back with Greg Russell, pharmacist and founder at Fort Wayne Custom RX. We are talking about a complex process in the body called methylation, and we're trying to make it simple and relate it to specific conditions. And one of those is autism. There is a connection between the way your body methylates and autism.
Yeah, so again, they were kind of looking at, they were doing some gene mapping, and they found that they took samples of They use PCR. So we all learned about PCR this last few years, have we not?
In the COVID world,
yeah.
right?
So because of PCR, they were actually looking for certain patterns, and they saw those patterns. The question is, again, how do you treat that? And typically, a lot of people will use vitamin therapy, the active methylated vitamins, because of those methylation patterns. And again, of course, what the trigger is occurring earlier. Why is it? It's occurring sometime during the pregnancy or very shortly after the delivery. So again, it's fascinating research. I think more to come on that. Probably ADHD is the one that most commonly, and there are actually prescription nutritional products that are basically fairly similar to the over-the-counter nutritional products that we're talking about now. Of course, the prescription ones require prescription. Right. They tend to be real high dose. They tend to be very expensive too, and insurance doesn't cover them. So, there's definitely a place for the over-the-counter nutritional products if the doctors want to use those instead. But what they did on that course was they actually sampled umbilical cords of mothers, and they did a fairly large study. They looked at it, and again, they were looking for these methylation patterns, these gene patterns, and they found basically 2 or 3 different sites that seem to be very common. The confounder, or what kind of is confusing about it, is they did the same thing with children. They took blood samples and they didn't find those gene patterns. So, more to come. Why were they triggered? Why did the kids with ADHD have these certain gene patterns in the umbilical, but they didn't have them when they aged? So it's confusing data. But again, I can tell you from having hundreds of parents come in with ADHD for their kids, we put them on methylation vitamins, and it seems to help.
So give me an example of what is a methylation vitamin that I would
so
take.
The big one is MTH, which is methyltetrahydrofolic, and that is folic acid, the active form of folic acid. So we use those. We usually have to start low in the 1 milligram range, but it goes all the way up to the 15 milligram. And then we would also probably give some methylcobalamin, which is methyl B12. So those are the 2 common things that are given.
So these are special activated vitamins.
Right.
Special forms of ordinary vitamins.
Right.
And then what effect what are parents telling you they're seeing?
Well, they see the kids have better focus. Or their behavior improves. Now, it becomes very complex with ADHD. Not all kids respond like that, and sometimes we have to use some fish oils and some other type of things, and that's a whole nother radio cast.
Yeah, I think it might be. But, again, I always mention this whenever you're on. That is one of the advantages of working with someone like you, who is a clinical nutritionist and a pharmacist. You understand things from both sides, and you encourage people to come in and talk with you.
Absolutely. I think that's what brings me great joy, is being able to spend the time to explain these processes out and try to make a difference.
That's great. So women and their special needs with estrogen, and what a powerful hormone that is in their bodies, and how does that affect the whole methylation cycle?
Again, earlier we talked about how methylation occurs in the liver, and it's your body's detoxification process. It's one of the last steps to get the chemicals out. And so I tell people methylation, estrogen basically goes down 3 different pathways. It's like 3 different roads, okay? And there's a good road, and there's a less traveled road, and there's a terrible road, a rocky road with lots of peril. And if you have too much traffic on the good road, they're going to start taking the arteries and start using the worst roads. What we're trying to do is prevent you from going off the tracks and hitting the bad road. So methylation is that process that helps eliminate those hormones and keep them on the highway, keep those cars on the good road. And so there's different things that can be done, but probably from the cruciferous vegetable point, there are 2 chemicals called diindolylmethane, and I3C, indole-3-carbinol, which are found in cruciferous type vegetables. Okay?
So broccoli, cauliflower, all of those things.
Right. Now the problem is if people that are taking hormones, or they have risk factors where they've had cancer, we like patients to be on these because we're just trying to make sure you don't go down the rocky road. Okay, and that's what these hormones, or what these nutritional products do. And so I like these products because they're very safe. But again, who's going to eat a bushel basket of broccoli sprouts every single day? I like broccoli sprouts, but I can't eat them every single meal. And then I want the potentized portion of it. So again, we're trying to help that metabolism, and it's also good for even men because we know testosterone also goes down similar pathways, and we need to, for example, if you have prostate cancer, we like these products too. So
what do I ask for, or what are you going to steer me to?
Yeah, there's actually two products that we use. One is called Estro Guide, and that has the diindole methane and the indole 3-carbinol in it, which is from the cruciferous vegetables. And I like that for most patients that we just are putting them on the estrogen products. We're just trying to keep them safe, and you take one capsule a day typically on that. There's another product that's the same thing, very similar, called CDG Estro Guide, and that stands for calcium D-glucarate. So it's basically Estro Guide plus another product called calcium D-glucarate. It's a more potent form, and I use that for women that have cancers, or if there is testing that you can do. You can do a urine analysis to see how much of it's going down the good highway, how much of it's going down the rocky highway. And those would be, and again, it's all gene driven. Okay, so we like to use that one just to make sure patients are safe that have really bad outcomes or they're experiencing side effects.
So if I am interested, I've got your attention now on this whole methylation issue. How do I know that what I'm feeling might be related to a disorder there, and what can you do to help me with that?
Yeah, so good question. And I'll back up for just a quick question. I also like using these forms for women that are on birth control pills. Because they are definitely going to go down the wrong highway. So, we want to make sure those end products, we're not going to drop your levels of your hormone, but we're going to make sure that the breakdown products are eliminated safer from the body. So there's quite a few people that take oral contraceptives too.
Yeah, absolutely.
And they probably, we're trying to prevent that problem that you're going to have 20 or 30 years down the road potentially. So again, your question, back to answer that, we have to really look at your medication, your history, what's going on with you. I have heart disease. I've had heart disease in my family. I've had cancers, whatnot. We try to evaluate the patient on a whole. And basically it's a question and answer. You have to come in, we have to ask the questions, and we have to get the answers. And so that's why we like the consults, but we're also available for quick questions and answers at any time at the pharmacy.
And that is at Fort Wayne Custom RX. They are at 425 East DuPont Road, right behind the Casa Grill. You can order products online at fwcustomrx.com. If I go and ask my doctor about this, hey, I heard Greg talking about this methylation thing. Is that anything I should be concerned about? What are they likely to say?
Yeah, I think probably most doctors aren't as informed as they probably. The information's out there, but you really have to dig to find it. But as time has gone on, I think more doctors are getting involved or understanding the process. We do have doctors that send patients in all the time. Some of them are integrative doctors. Some of them are just more conventional heart doctors. So I think doctors are starting to pick up on it. But I would say if you asked me that 20 years ago, I would say most doctors would say, it's nonsense. But I think the science is starting to catch up with it, and I think the proof, some people feel better, so they know.
Well, that's great.
Yeah.
Well, we just taken about half an hour to discuss it here. You don't get that kind of time in the doctor's office, so how is he going to explain that, right?
It's complicated. That's why we did 2 shows on it.
Yeah.
Because we knew it would be, if I did a seminar on it, I'd probably spend 2 hours on it.
Wow. Yeah. A lot to consider, a lot to talk about. That is Greg Russell from Fort Wayne Custom RX. And as I said, you can find them online at fwcustomrx.com.